The clinical presentation of a patient that is infected is that generally a patient that is infected is going to present with fever. Is it clear? It's either the patient is feverish, or there is hypothermia. Either there is hyperthermia or there is hypothermia. It is a sign that the patient is infected. Now, another thing that can show that a patient is infected is at the sympathetic nervous system activation. Is it clear? Sympathetic nervous system activation. Sympathetic nervous system activation is also going to be activated in patients that are always going to have an infection. Now, in case of sympathetic nervous system activation, you have one. The first one, you have toxemia. Toxemia means that what the faces of this patient, toxemia means that the patient are diaphoretic, they are restless. So you can visualize that on the physical examination. They are diaphoretic, they are restless, they are agitated, they are nervous, they have also an altered level of consciousness. All that can be seen under toxemia. Is it clear? So there are signs of toxemia that can be seen in sympathetic nervous system activation. Is it clear? Another sign of sympathetic nervous system activation can be vomiting. Is it clear? Because of reduced peristalsis. Is it clear? And since there is vomiting, the patient is also going to become anorexic. Is it clear? Because there is vomiting and there is reduced peristalsis. There is also going to be the saliva of this patient are going to be much more of thicky. They are going to be foamy. Saliva in cases where you have sympathetic nervous system activation is much more thick and foamy, like when you're doing sports. But the saliva in cases of patients that have parasympathetic nervous system activation is going to be instead slippery. Is it clear? So these are how we can know sympathetic nervous system activation. In addition to that, in sympathetic nervous system activation, you're going to have tachycardia, tachypnea. You're going to have tachycardia, tachypnea to compensate. Is it clear? And then later on, you have hypotension if the sympathetic nervous system activation fails. Is it clear? Now, after the signs of sympathetic nervous system, generally those are the signs that shows that there is an infection in a patient, the clinical presentation of infections. Now, you have to know that there is also a particular factor of patients that are infected. Is it clear? Patients that are infected have a particular factor. There is a factor always if there is an infection of the mouth. Generally, when there is infection of a particular organ, there is a particular factor that comes out from the patient. Is it clear? That odor is not a normal odor. The odor is coming from the microorganism replication. Is it clear? So there is a particular odor that a patient does not usually have, but is going to be in a patient. In the case of necrotizing fasciitis, it is a particular odor. In the case of gas gangrene, there is a particular odor. All of them have a particular factor in order to know that there is an infection. Is it clear? So those are the different elements of infection. And now, when you have after seeing these systemic signs of infection, you can now go to the local signs of infections. Is it clear? Now, for the local signs of infection, apart from the signs of inflammation, you are going to see signs of inflammation, which are the redness, heat, tenderness, and loss of function with swelling. Is it clear? So those are the signs of inflammation you are going to see locally. And if you don't have signs of inflammation, and you have also consolidation syndrome, it's just signs of inflammation that are going to be heard at the level of the lungs. Is it clear? Now, if you don't see signs of inflammation, you can have also drainage. Is it clear? So drainage or discharge. Generally, discharges that come from those particular regions can also target you on which infection is there. If there is a purulent discharge, it can tell you that it's a bacterial infection which is pyrogenic, like Staphylococcus aureus and Streptococcus pyogenes. Is it clear? If there is a greenish discharge, you can think of Pseudomonas aeruginosa. If there is a bluish discharge, you can think of the Mycobacterium family. Is it clear? If there is a caseating discharge, a thick caseating discharge, think of still of the Mycobacterium tuberculosis. Is it clear? Caseating means that it is thick and it is cheesy like. Is it clear? Discharge, you think of Mycobacterium tuberculosis. So all those are the different things that we have to think in cases of patient that has infections. Now, after thinking about that, you have now the diagnosis of infections.